We have many wonderful medications at our disposal. Some of them can cause, unfortunately, some pretty serious side effects and some unpleasant side effects. And others can interact with each other and be interacted upon by that CYP450 system. But what happens if the medication doesn't quite do what we want it to do? If it's doing a little bit, but we need it to do more, then we have this wonderful thing called trimonoaminergic, say that 3 times fast, modulators. And the principal one that Stahl spends a lot of time on, and I think justifiably so, is estrogen, because of estrogen's interaction with the serotonin and norepinephrine systems. And it is important to consider the special health needs of women across the life cycle, but especially the special care of pregnant and postpartum women. Now, I'm not going to go into detail on this. However, I'm going to post 2 things for you. A slide PowerPoint presentation by Dr. Christine Wickman, and it's an excellent PowerPoint giving a lot of good information about the importance of treating women for depression and how it has to be a collaborative process, and it is ultimately the woman's decision. But we have to weigh the benefits and risks of the mental disease of depression or psychosis or bipolarity, and that's effect on both the developing fetus and the mother's ability to care for herself during pregnancy and to bond with the child once born, or the effects of medications, the side effects, and the possible consequences to the fetus. So it's a very delicate, difficult issue. I will post that PowerPoint. I also will post another of Carlot's psychiatry reports in which he talks about it as well. Then there were some other augmenters that Stahl mentioned that I'm not going to go into because I can hardly even pronounce them. The L-methylfolate 5-methyl tetrahydrofolate, thank God they call it MTHF, and then the S-adenosylmethionine or SAMe. I have some information on that in another Carlat report. I'll look for it and probably put that up as well. But one of the main things that we do to augment the medications that we're using is that we use other medications. So we're using a serotonin reuptake inhibitor, but we're not getting enough of the norepinephrine dopamine activity going, and the person is still not showing an increase in positive affect, even though they've had a decrease in negative affect. And so we might want to consider using something like bupropion, a norepinephrine dopamine reuptake inhibitor. So we also augment. Now that's another wonderful thing about our Stahl Prescriber's Guide book, is that for every medication, he talks about some of the augmenting possibilities. All right, we have 1 slide to go.